The whole thing. So this is a blood smear made gigantic. So we have red blood cells, we have white blood cells, and we have platelets on this plate. The red blood cells are these red ones, obviously. They're red. The platelets are these small little chunks. They're blue on this because platelets are just fragments, the thrombocytes. And then as it comes to the white blood cells, we have two groups. We have granulocytes and agranulocytes. The granulocytes, when we stain them, they give us granules. Like here, these granules are reddish. They have granules too, that there's just texture, they're neutral. And these down here are bluish. The bluish ones are called basophils. The neutral ones are called neutrophils. And the reddish stained ones are called eosinophils. And then we have two other cell types on here that we're interested in. This big one with a nucleus that's sort of boomerang shaped almost. And then the one here that is smaller, but the nucleus is almost as big as the cell itself. The big one is the monocyte. And the smaller one is the lymphocyte. When we look at the plate with the blood vessels, we can make up a few of them very clear and some of them are not so clear. So I want to just point out the ones that I'm interested in you knowing on the plate. As we exit the heart, of course, we have the ascending aorta that turns into an aortic arch and then goes down behind the heart as a descending aorta. The first vessel coming off of the ascending aorta is the right brachiocephalic trunk. Then that splits immediately into a right subclavian, into a right common carotid. As we follow the aortic arch further, the next one coming off is the left common carotid, and then the one further down is the left subclavian artery. As we take the subclavian further and we get underneath the axilla, we call it the axillary artery. If we get into the upper arm area, it's called the brachial artery. As we go into the forearm, the thumb side runs the radial artery, and the pinky side will have the ulnar artery run with it. In terms of the veins in the upper extremities, I'm mostly interested in the cephalic on the thumb side and the basilic on the pinky side. In the heart area, I do want to point out this one. That's the pulmonary trunk that splits immediately into a left and into a right pulmonary artery. Now make a point that this is blue and it's an artery because the vessel carries deoxygenated blood away from the heart. Artery is away from the heart. So keep that in mind. Then we look at the vein on top here coming right back into the heart. That would be the superior vena cava. Let's go back to the artery in the abdominal area and the lower extremities. So we pierce the diaphragm. The descending aorta changes its name from the thoracic aorta to the abdominal aorta. So this here is the abdominal aorta. One of the first offshoots we have is the celiac trunk. It looks like a little cross. I'm not going to worry about these here. I'm worried about the ones that go to the kidneys because they're nicely outlined, and those are the renal arteries. As the abdominal aorta goes inferior, there's multiple more offshoots off of it, feeding the internal organs, but at some point we split it into two common iliac arteries. And the first offshoot coming off of the iliac is the internal iliac. Afterwards, that larger artery changes its name to the external iliac artery. As we go into the thigh area, my main concern is the femoral artery. And then I'm not worried in here. I will mention again down in the lower leg. What I will tag is a tibial artery. So we can't really make up, this is an anterior tibial, but we can't really see the fibular artery. So we just go for tibial. This here is a posterior tibial. And then lastly, one more, but the vein coming up, the big superficial vein here is the great saphenous vein. And that's the one that I will tag there. Again, we also, of course, have the external iliac vein. We get the internal iliac coming right off of here, and at that point it's called the common iliac. As we get into the great vessel, it's called the inferior vena cava, going into the heart.